Hello, everyone. My name is Rujvi Thakkar, and today I'm going to be presenting on harnessing traditional medicine for global cancer care. To start, I'm a rising junior at Langley High School. I participate in Women in STEM, Model UN, and American Red Cross. I've been a swimmer and a dancer for around my whole life, and currently I'm working in a lab researching cancer immunology and traditional medicine while shadowing psychiatrists. When I grow up, I do want to be a psychiatrist. To start, cancer is one of the most formidable challenges of our time. According to the World Health Organization, 20 million cancer cases were diagnosed globally in 2023 alone. This statistic underscores the urgent need for innovative approaches to cancer treatment and care, not only to alleviate the cancer patient's struggle, but also alleviate the burden that cancer causes to the patient and their family and friends. While modern medicine has made remarkable strides in cancer treatment, through chemotherapy, radiation therapy, and surgery, these approaches come with significant drawbacks. Recent studies in cancer centers in the UK have found that all of these treatments lead to excessive cognitive decline in patients. With 25% of patients utilizing chemotherapy, 50% radiation therapy, and 60% surgery, this solution becomes questionable. This leads me to my research question. How can traditional medicine integrated with modern oncology improve cancer patient outcomes? Now, complementary and alternative medicine, otherwise known as traditional medicine, offers a philosophy fundamentally different from Western medicine. While Western medicine focuses on treating the disease based on patient symptoms and methods such as drugs and surgery, traditional medicine approaches cancer treatment holistically, considering not only the physical symptoms, but the patient's overall physical and emotional balance. The World Health Organization has highlighted a critical gap in global cancer care. A survey of 115 countries revealed that a majority do not even adequately finance priority cancer and palliative care services as universal health coverage. Traditional medicine offers three key advantages of bridging this gap. The first is cultural acceptability, as traditional practices are often deeply rooted in local cultures, making them more readily accepted by patients. The second is a holistic approach, because by treating the whole person, not just the disease, traditional medicine can improve overall well-being. The third is accessibility for all, as many regions, traditional treatments are more readily available and affordable than modern medical facilities. Now let's explore how different traditional medicine systems approach cancer care. The first is traditional Chinese medicine. TSM has been used excessively in cancer care, particularly in the phase of rehabilitation. Many cancer survivors report that astragalus and acupuncture have lessened their side effects of chemotherapy and helped rebuild their immune systems. Next, we have traditional African medicines. Black seed and fenugreek are used in African traditional medicine and are believed to be able to replace modern healing methods, as they have anti-inflammatory properties, antioxidant effects, blood sugar regulation, and hormone regulation. Next, we have traditional Indian medicine, or Ayurvedic medicine. Ayurvedic medicine offers accessible palliative care services, focusing on managing symptoms and improving the quality of life for cancer patients. With wound care, medication, herbs, and gargling, a patient could improve their health greatly. Now, recent clinical trials have shown promising results for the integration of traditional medicine in cancer care. A study of the herbal oncology program involved 851 outpatients, with 84% of them being in active cancer treatment. The program dispensed around 1,200 herbal prescriptions, primarily addressing pain and treatment-related fatigue and mood disorders. Patient satisfaction was extremely high, with out of the 107 patients allowed to complete the interview, 70.9% showed that they were completely satisfied with the herbal prescriptions results. Only 6.7% struggled with mildly adverse effects. Patient feedback related to the traditional medicine has also been largely positive. Many patients noted that traditional medicine, particularly TSM, was their main choice during the rehabilitation phase. In the first example, the patient shares a story where he hasn't felt any implications of surgery due to TSM. He also shares how his mother has been 30 years cancer-free due to the Chinese medicine that she's been taking. In the second example, we see that the patient shares that TSM has stopped her tumor from growing. Patients view traditional medicine as a harmless and non-invasive method of treatment, contrasting sharply with the Western medicine they've experienced. Despite its potential, integrating traditional medicine into mainstream cancer care faces several challenges. Traditional medicine is widespread in Ghana, as 80% of Ghanaians rely on its methods for primary healthcare. This leads to four main challenges: a lack of understanding of traditional medicine, equipment scarcity, high turnover of biomedical staff, and declining interest as healing as a profession. We also see that healthcare costs have been rising like never before. These healthcare costs will result in cumulative medical costs that can cause huge economic burdens on the patient. As we move towards integration, we also must navigate several ethical considerations. One, we must always balance respect for traditional practices. Two, we must protect traditional knowledge. Three, we must ensure patient safety. Four, we must balance investment in traditional and complementary medicine with other healthcare priorities. Five, we must ensure that patients are fully informed about traditional treatments. And six, addressing disparities in access to both conventional and traditional medicine. Now, for the future. These are various regulatory bodies worldwide that are working to oversee the integration of many different medicines. These agencies play a crucial role in ensuring the safety and efficiency of traditional treatments as they enter mainstream healthcare. To harness the full potential of traditional medicine in global cancer care, I propose the following action plan. First, we must increase funding for research on traditional medicine in cancer care. Second, we must have and encourage collaboration between traditional healers and oncologists. Third, we must host comprehensive education programs for healthcare professionals. Fourth, the development of insurance policies that can cover traditional treatments. As we stand at the intersection of traditional wisdom and modern science, we have a unique opportunity to transform cancer care globally. By integrating traditional medicine into our approach, we can potentially reduce healthcare disparities, improve patient outcomes, and create a more holistic, culturally sensitive approach to cancer treatment. So my references. I would like to thank GHLC at JHU for allowing me to present my findings, and I would also like to thank the Georgetown Lombardi Cancer Center for allowing me to continue research on this topic. Thank you.